Okay, I'm going to go next to Vicki Scanlon. She is our third speaker for the night. She is the Chief Executive Officer at Charlotte Behavioral Healthcare in Punta Gorda, Florida. Vicki is a licensed mental health counselor and has worked as a clinician and administrator in community behavioral health for 23 years. Her clinical career created a passion in treating adults with serious mental illness with an emphasis on criminal justice diversion and eliminating suicide. She joined Charlotte Behavioral Healthcare in 2006 as clinical director and quickly assumed oversight of quality management. She was then promoted to operating officer in 2007 and remained in that position for 9 years until assuming the role of chief executive officer in May of 2016. Scanlon holds a bachelor's degree in psychology and an educational specialist/master's in education with a specialty of community counseling and mental health counseling from the University of Florida. She is originally from Venice, Florida, and moved to beautiful Charlotte County 20 years ago. Victoria is happily married to husband Keith and the proud parent of 3 children and 3 stepchildren. She's dedicated the majority of her life to helping others, and that mission will never change. Welcome, Vicki.
Thank you so much, and greetings everybody from Punta Gorda, Florida. I would echo the comments of the others. It really has been a professional and a personal pleasure to work and interface with the Archways staff, and so it's just such a blessing to us. A little bit about Charlotte Behavioral Healthcare. We are a nonprofit. We serve over 12,000 individuals and families in both Charlotte and DeSoto counties. We provide mental health, addiction, and co-occurring services to youth and adults, and we do that on an outpatient basis in the community and inpatient as well. So we pretty much have the full continuum of services. We have been a MAT provider for probably about 8 years, beginning with Suboxone, quite some time back, and we're very excited to add Vivitrol over the past several years. So one of the first questions I'm going to follow the outline as well is, how has COVID affected our staff and our patients and the organization? And clearly COVID-19 has affected everybody's world, and CBHC is no exception to that. Our services do continue, but in a completely different way, and I know everyone has spoken to this. Our patient population is definitely emotionally affected right now, as all of us are. We're seeing a lot of widespread anxiety, and we know that anxiety is already very prevalent in the United States and among our youth, and certainly there's a lot to be fearful of right now. And so the folks that we're seeing, regardless of their diagnosis, they're fearful for their jobs, and they're fearful for the economy. They're fearful for their lives. I was scrolling online last week and actually found an online death calculator where you could plug in your age and any risk factors, and it would tell you the percentage likelihood of your death over the next year. And so all of this information, especially some of the fear-driven information, is really creating a lot of anxiety among the population, but in particular the populations who are vulnerable that we serve. And we're also seeing that folks are very uncomfortable going out. Some folks boldly go out, other folks are very fearful to go out. But I've been watching in the news that individuals, even who are having a heart attack or a stroke, are fearful to go to the ER because of the fear of contracting COVID-19. And so, as everybody is saying, it's really important that we are a responsive treatment community and can kind of meet our patients where they're at. And they are certainly more comfortable at home right now. Just another interesting trend that we're seeing is that families are at home with their children. I have 6 of them, and we're home with our kids a lot more. And with that increased time spent, they are identifying behavioral health issues. And these might have been issues that teachers were noticing in the past, but I think that all of us as family members have gotten the chance to really spend that time with our family. And so I think that's a positive trend, and I think that it's very helpful to get families involved, especially with youth from a very young age, in identification of symptoms and getting these kids into treatment. So I would agree with all of the comments that all in all, telehealth has been a very effective solution for us. In Charlotte and DeSoto counties, public transportation is very limited. So telehealth removes that barrier. And of course, childcare, many of our families aren't able to get the childcare they need. And so we've known all along that telehealth could remove some of the treatment barriers to get people more involved and more consistent and attending their appointments. And we're actually seeing that happen right now, despite the chaos, that people really are able to follow through with their appointments virtually. And I think that we also have to recognize some of the staff perspectives on this. I know that staff are struggling with their own concerns and their own stressors, and they're caring for their own families as well. I'm very empathetic. This is my first Zoom presentation. Thank you for bearing with me. But it really made me think to the changes and the challenges that our staff have faced. Doing a presentation in person is quite different than talking with you all tonight via Zoom. And so our staff are having to adapt to those situations. And like I am hoping that technology cooperates and that things go smooth so that they can continue to help their patients, and they're helping patients with their technology struggles and of course dealing with their own technology challenges. And so I think that for those who weren't doing telehealth, it's definitely a new skill set that we're asking them to develop very rapidly. Some of our staff were already doing telehealth, but they are doing evaluations and they're doing treatment via telehealth. And so our staff are going to need more tools and training as we go. And of course, time is going to help them adjust to this new treatment modality. In regards to CBHC services in general, CBHC services have continued, even though many of them look quite different. We are starting to see an increase in local overdoses in Charlotte County, and we have also seen a recent uptick in our detox referrals. For a while they were down, and now they are actually back up and higher than usual. We're continuing MAT services, and our peers are working very hard to engage, whether it be on the phone or via video conferencing. We did close down our residential services temporarily. We plan to resume it. We've been very concerned about our ability to have healthy staff and adequate PPE through this pandemic, and so that was a concern probably for most of the providers that have spoken, just ensuring the safety of the staff and the patients. And so we look forward to reopening residential services in the fall. All other services are very quick to access, as others have noted that our no-show rates are lower, and we can get folks in actually a lot more quickly right now than in the past when we were doing more in-person services. So in terms of thinking past the pandemic, and that's really odd because none of us really know the end date on this, I think it's a really good time for us to dream and to put a positive spin on this and to create a vision of the future that looks quite different than the vision of what we're used to in the treatment world. And so to me, that's the really hopeful side of all of this. And so, we're all kind of reflecting, what are the lessons that we can learn? And what we're seeing on the provider side, and what we wonder is more frequent access and convenient access to a therapist going to help folks stay in recovery from their mental health or substance disorders? We've also seen a loosening in Florida anyway. We've seen that funders such as Medicaid have loosened restrictions on the amount of individual therapy visits, loosened restrictions on telehealth. And so they may be spending a little bit more here, but are they in the long term going to save on the other side with some of the deeper end services like inpatient and residential? And so I think time is going to tell what this looks like, but what we're seeing right now is really encouraging, that folks are engaging in services, they're engaging them in them more frequently, and will that in the long run affect their stability? And so from a recovery and a societal and a fiscal standpoint, that all sounds really good. And I hope that from an advocacy standpoint, all of us can continue to advocate that these frequent services and telehealth services really can be a difference maker for our patient populations. I think we're figuring all of this out. And so lastly, for those of you who are currently in the midst of addiction, CDHC and the providers here are definitely ready to help with detox and virtual treatment options. We have services quicker than you might assume, quicker than normal, so don't let the past discourage you from seeking treatment. In Charlotte County, we still have the Archways funded Addiction Recovery Initiative with the Charlotte County Sheriff's Office. You can still call if you need detox. You can still call and they will assist you with transportation services. And so, don't let it, in general, please don't let be a barrier if you are out of work. Operating on a sliding scale, and so we just want to ensure that we get you into treatment and get you supported right away. And if you are not really sure you want to treatment, CHA is offering a therapy hotline for a week, and you can use that as time to tune up their mental health issues and that information is on our Facebook page, information about our therapist line. So then I think about the biggest game changers in history. Adversity is absolutely what shaped and defined them. And no great people have led simple, uncomplicated lives. And so from a recovery perspective, we're really hopeful. And yes, many of our folks are economically affected right now. And yes, we are seeing relapses, but some of our folks in treatment are enjoying more access to meetings than they ever have because of some of these virtual processes in place. And they're literally accessing people from around the world who are invested in recovery. And some of them are seeing a huge benefit to an expanded recovery network. And so I feel that the recovery and the treatment community is more mobilized than ever before, has less barriers from a fiscal billing perspective than ever before, and we're ready to help in new and creative ways. And so I heard a great quote today that everyone needs encouragement, but there are so few encouragers. And I want to thank each and every one of you out there in recovery and in the treatment world, because you are the encouragers. And I'm proud of what our recovery and treatment community continues to do, what the faith-based recovery continues to do, and all of us are continuing to be a force